The views and opinions expressed on this program do not reflect the company, owners, management, staff, clients, or partners.
Welcome to Bermuda's Daily Talk Show. It's the Daily Hour.
ChatGPT did become the world's most downloaded non-gaming app.
Literally the job of everyone in government to address the media and the public.
What are your thoughts, audience? What are your thoughts on Zandy Silva as the deputy PLP leader?
A community that can't feed itself is a community that doing.
What you may not know, though, is that Bermuda, we have a connection with Epstein, too.
Things that people are doing right, the youth are doing right, that is not being advertised enough.
When you see your access to U.S. dollars disappear, that's when you have a problem.
You've got a town in the UK with a similar sized population. This place absolutely outshines it.
It's Monday, the 8th day of June, 2026. Welcome to Bermuda's Daily Talk Show. This is the Daily Hour brought to you by the BAC Group of Companies, HSBC Bermuda, Medical House, Lindo's, People's Pharmacy, and a big love to Hot 107.5 for ensuring that we can pump through the radio airwaves with these most important community conversations. I'm Jamel Hartman. She's Teray Tull. Happy Monday to you, Teray.
Happy Monday. Happy Monday. How are we?
I can't complain. You know, I did some sprints this morning. I feel ready to go. I'm, hanging in there. I had a weekend to get over, the transition of Sir Dawn, and, yeah. How you?
I'm feeling good. I had a nice restful weekend. I didn't do any sprints, but I was very reflective. It's been raining all weekend here in Oxford, so that's helpful. And it's raining again today. So yeah, I'm feeling very calm and centered.
Why does rain feel so normal in the UK? Is it over at
It is normal. I thought it was kind of weird that everyone only ever talked about the weather when they talked about the UK, but now I understand it. That is actually the only thing to talk about because it's raining and cold and it's June. So yeah.
Okay. It's the only thing to talk about. We've got Suzanne Ingham says, good morning. Hamala, she means Jamal. The awesome day to be alive and in your TDH house. Suzanne, we are happy to see you here this Monday morning. Have a great day, and thanks for starting it with us. Mark Arthur says, good morning, TDH family, and a great morning to you as well, cousin Mark. We've got James Burgess into his house. Says, good morning to the Daily Hour team show. I'm watching and listening. Welcome to your guests. Have a great day. Thank you.
Good morning.
Suzanne says, Teray, you are back. Good morning, Teray. I'm so happy you are back.
I'm so happy to be back, Suzanne. I missed you.
2 weeks in a row, right, Suzanne? I mean, my goodness, who knew? No, hey, Suzanne, she started something. I ain't calling no names, but
what?
Somebody said last week, I miss it. I'm coming back next month. I'm not calling no names, right? But they all coming back. They miss you all. They miss you all. They miss you all.
No, we do. We really do miss you guys, and we're happy to be back. So let's have some fun.
I'm gonna start calling some names. I'm gonna hit Taj up. I mean, Taj ain't show up.
Listen, Taj was in the same boat as me. Yeah. They were writing a thesis, and they're also preparing for final exams. Okay, not too much on us. We're still students. Okay, we're still students, and the degree comes first.
Can't rough them up. Truth be told, when I was finishing my MBA real quickly, because we've got a very long show today, a lot of the students were jealous of me because I completed my thesis 3 months early, and it was completed to the point where
3 months early.
A lot of edits. Well, here's why. Most were working jobs or other stuff. I just had nothing to do. All I was doing was working on my paper, and because it was focused on the industry I had previously worked. Well, I work in now. I still had a lot of contacts that were working with me with the research and so on. So in saying that, I was able to get assistance from the professor, the director of my MBA program, and edits and changes because I finished early. So help perfect the paper, which I eventually got an A+ on. I just wish I could find it.
I like how you just stuck that in there. Eventually got an A+ on. Congrats, Jamal.
But I need to find it. I think I lost it in the divorce. I can't find it.
Wait, so you didn't have it on a flash drive or like a Google Drive or nothing?
No, but no, it's flash drives from then. I don't even know where they are, Teray.
No, but Jamal, I'm still
an email.
stuck on the fact that you finished it 3 months early and got all this feedback. I can guarantee you that's not the situation with me or Taj. Like the deadline is the deadline for us, and I'm just kind of a procrastinator when it comes to these things. So I definitely took my time with it. But shout out to people like you who finish it early. I'm finishing on time.
Only thing I probably did like that. Trust me, it was, and that was just because I was really loving what I was writing about, which my business and business plan. So, all right, well, folks, let's get into today's discussion. Look, we got the tragic news Thursday evening, and no matter how one felt about his politics, it would be difficult to argue against the impact Sir John Swan had on Bermuda.
Yeah.
Over the last few days, we've heard people share stories, memories, and opinions about his life and legacy. Some people have focused on his time as premier, others on his business accomplishments, and many have spoken about their personal interactions they had with him over the years. What has stood out to me, though, is that regardless of political affiliation, there seems to be a genuine appreciation for the role he played in shaping modern Bermuda. For me, Sir John was always bigger than politics. He was one of those individuals who seemed to genuinely love Bermuda and wanted to see Bermudians succeed. Whether you agreed with him or disagreed with him, there was never any doubt that he cared deeply about Bermuda and its people. Personally, I'm grateful for the opportunities I had to spend with him. He was never short on advice, never short on encouragement, and never seemed too busy to have a conversation.
Yeah.
An era where many leaders can appear distant or inaccessible, Sir John had a way of making people feel comfortable. It didn't matter who you were. If you approached him, he would engage with you. I think that's one of the reasons why so many who weren't even alive during his premiership still speak about him with admiration today.
Yeah.
They know his name, they know his story, they know the impact he had. Very few leaders are able to transcend generations in that way. Now, as with any leader, there are people who will remember what they believe he could have done differently. That's part of history, and that's fair. No leader is perfect, but I suspect that for many Bermudians, the lasting memory of Sir John Swan will be the opportunities he helped create and the belief he had in Bermuda's potential. What I always appreciated was that he seemed to understand that leadership wasn't about being the loudest voice in the room. It wasn't about creating division or constantly reminding people you were in charge. It was about having a vision, bringing people together, and creating an environment where others could thrive. Now, maybe that's the lesson Bermuda should take from his life. We often talk about leadership. We often talk about what the country needs. Sir John's legacy reminds us that effective leadership doesn't have to be flashy, arrogant, or performative. Sometimes it's about building bridges, creating opportunities, and helping people believe that a better future is possible. He was Bermuda's longest serving premier. He was a national hero. He was a businessman, a community leader, a mentor, a husband, a father, and a friend to many. But most importantly, he was a Bermudian who dedicated a significant part of his life to serving the country he loved. I think I speak for many when I say thank you for your time, wisdom, and work. May you enjoy your rest, Sir John. This morning's question is, what are your thoughts? Or I guess, not what are your thoughts, but how should Bermuda honor Sir John posthumously? How should Bermuda honor Sir John posthumously? We've seen some ideas floating around on the internet. What are your thoughts? And when we come back after this, we'll give you the poll question as well. This is your daily discussion brought to you by Titan Express and Secure.
People's ACW, located at King Edward VII Memorial Hospital, carries over-the-counter medicines, toys, cards, and even toiletries. Our knowledgeable staff are there whether you're at emergency, visiting family, or a member of BHB staff, to show you our best even when you're feeling your worst. People's ACW, we're here for you.
Alrighty, folks. This is your daily discussion brought to you by Titan Express and Secure. We're asking the question: how should Bermuda honor Sir John Swan posthumously? What do you think the best way to honor Sir John is? He's already a national hero. Some have said the airport's named after L. Frederick Wade. We've got the Dame Louis Brown Evans building. There's been suggestions of naming East Broadway after Sir John, name it Sir John's Way. He spoke about that one too, and I found a lot of clips using AI, something I learned at the National Association of Broadcasters conference on how to find things. And I was able to find so many clips of Sir John throughout the years on the Daily Hour using these tips and tricks. And he did speak on that at one point, but I hadn't edited. But what are your thoughts? What do you think we can do to honor him? Some people have said, have a holiday. I'm like, you all just want another day off from work. I get you.
And Sir John would have approved. Thank you.
I get you. I'm with it. But what are your thoughts? Let me just add to this, and Tareya, you jump in. But we are talking off here, and people have said Sir John's the last statesman Bermuda had. I think to properly share what Sir John meant to Bermuda is the closest leader that we've had in my lifetime to Sir John was probably Dr. the Honorable Ewart Brown. But outside of that, you just don't see people. You don't see people gravitating to politicians today.
Anyone, really?
For the two people who are vying for the PLP leadership. But here's the difference between Sir John and leaders that we have today. Sir John will go into an office with Donald Trump and negotiate and come out a winner for Bermuda because he has a boss mindset. With respect to Curtis Dickinson, with respect to a Jason Hayward, I just don't get that same mindset. It comes across employee-like. It comes across like we're going to negotiate to make sure we don't get the worst deal. Sir John negotiated to get the best deal because he was a businessman, not an employee, but a businessman, the owner, prior to getting into politics. That to me is the difference in the kind of leadership Bermuda once had versus the kind of leadership Bermuda has today. And I say that not to disrespect the two candidates, but the reality and how leadership has evolved. Remember, one of Sir John's biggest concerns on this show is we no longer have the best getting involved politically anymore. People's jobs, he said, are not allowing them to get there. Again, that's not the question this morning, folks. The question is, how's the best way to honor Sir John posthumously? And here's your poll question. What do you believe Sir John will be remembered for most? 1, economic success. 2, independence referendum. 3, being the longest serving premier, or 4, other. Let us know your thoughts.
Yeah, I think there's so much that one can say about Sir John Swan. Like, he was absolutely a statesman, but a really consequential figure in modern history. Like, people my age had a lot of reverence for him, but also he was one of the few people who stayed active after they left office. Like, Sir John Swan was painfully visible. Like, he shared his opinions on CARICOM. He always came in the Daily Hour. Like, he just clearly loved Bermuda and just embodied, I think, a true statesman spirit that I haven't seen yet in politicians in Bermuda, but also just people in Bermuda. Like, I think he was a really rare type of person. But to the question, how should we honor him? I think we could take him at his word. In the letter that was released after he passed, he told Bermudians to take care of each other and take care of Bermuda. So I think that's a first step. And then we can go into the formalities of like holiday, naming something after him. But I think more importantly, like Sir John Swan spent the last 2 years of his life kind of urging Bermudians to look around and take stock and make a change. So that's what I have really been thinking about. And I think our honoring of him should reflect a lot of his advocacy that came in the last days.
You know what's interesting? Sir John Swan didn't run in that election last year and the year before in that by-election to win. He ran to wake people up. He ran, and what? He succeeded. You know why? Because we had a record number of independent candidates running. None of them won, but it was a success because he got people to understand their place. And while we may not have seen necessarily the results in victory for any independents, it was a wake-up call to the parties that remain, that exist, that if you don't get it together and these independents stay on the trail, Bermuda's political atmosphere is going to look very different very soon. People have said, let's go to the audience. And again, audience, the poll question, answer the poll quickly as well. 1 for economic success, 2 for independence, 3 for longest serving premier, and 4 for other. What do you believe Sir John will be remembered for most? What do you think he'll be remembered for? Personally, me, I think he's going to be remembered for the economic success, because even those on the lower end seem to benefit and live well under his premiership. I think that's what he's going to be remembered for. Bermuda, many people will not remember the boom Bermuda enjoyed that most benefited from was due to his economic success, his ability. Was it the 1985 trade agreement with Ronald Reagan?
1985 tax treaty, Ronald Reagan and Colin Powell.
That was huge. And I don't think those are the things that people need to know. What we got in the audience, Teray?
So we have a lot. Nick Hassel says, celebrate him again on Heroes Day as it is a holiday. Mark Arthur C. Phillips says, national holiday is the first thing that comes to mind. Island Girl says, a statue of Sir John Swan at the western end of East Broadway, a mandatory curriculum for schools with a textbook created, a mural at our airport as he was internationally renowned. And James Burgess says, build another statue. And then Hedeline Swan wants to share a memory. She says, may I share a memory, please? I was 8 years old and Sir John Swan gently yet appropriately kissed my forehead in town, and I promised to never wash my forehead again. Sir John Swan was simply awesome. And Suzanne Ingham says, yes, a holiday just for him. Every year is his day, a holiday. He wants us to be in unity, looking out for each other. I'll work in unity and look out for others in his honor. Not that I don't do that already. And Traveling Trotty says that she thinks Sir John Swan will be remembered most for option 3.
I get to the
3.
poll. I want to get more people on the poll, though. Traveling Trotty said 3, but answer the poll. What do you believe Sir John will be remembered for most? What do you believe, Teray?
I think it's hard to say one. I think he's going to be remembered for being an incredible politician and businessman. So it's hard for me to say one because he didn't live a unitary life. Like, he was very multidimensional and was very successful in both politics and business. And I think that's rare in Bermuda, but also just generally. So I'm going to go for other and just say a variety of different things, but also his spirit, right? Like, he had a high level of charisma, and not one that is manufactured because someone wants to go into politics. He had this essence about him that was clearly authentic. It wasn't contrived because someone felt called to service. It was really just who he was. Like, I think if he wasn't a politician or a businessman, he would be still out in the public doing something. There was just this aura to him of trust. And I think that drew people to him. So that's why it's hard for me to say one. Like, he had this really service-oriented spirit, but was a successful businessman and a really successful politician. So
Dr. King warned us about people like you, neutrality.
That's not neutrality. That's nuance.
No, I see what you're doing. No, but seriously, I take your point and I agree. I just think that the sad thing about, I'm going to use Dr. King since I mentioned it. The sad thing about Dr. King's legacy, it's been whitewashed to make people believe that his legacy was, I have a dream, and it was so much more. And I think what Ray is basically saying, we can't water down this man's legacy, not with everything he was and remains for Bermuda. And to put it as one thing would do his legacy a disservice.
Yeah. No one ever doubted how much he cared about Bermuda. You can say what you want about policy, you can say what you want about anything, but every time he came on the Daily Hour, do you remember he had the big red Bermuda book under him? Do you remember that? Like, it's just little things like that that just shows me that he was obviously always thinking about Bermuda and her people. And I think that that is incredibly rare.
Yeah, we're going to be sharing some clips of Sir John. Here's a really nice clip that he said. This was his first appearance on the show of this.
It's just an honor because you run such a great show. You have intellect, you have comedy, you have, it's very informative and it engages in the issues of the day. And I think that's very important that we stay current, not dwell on the past so much that we lose sight of the future. So I congratulate both of you for really bringing an audience and a process to Bermuda that I think is so essential.
Yeah, I think his first appearance on this show. And look, it meant a lot coming from him because I say it all the time. I don't expect people to tune into this. This show is informational, and people don't seem to like information, especially when it doesn't align with what's right. And so when you find out people tune in every now and then when they can, I have a lot of gratitude. I really do. And, I just love driving conversation. I love, finding solutions. I am a comedian. I appreciate him saying comedy. I haven't done a joke lately. Actually, I should pull out a joke for today. But in saying that, it meant so much coming from Sir John because he has so many other things to do outside of engage with the Daily Hour. And he made it a point, to always engage us. He was supportive. He was, I'm grateful. I'm filled with gratitude. And I appreciate, everyone who's given, so much to, so many words this weekend, so much feedback on what his legacy means. But here's what I would say in honoring him. Statue, I appreciate it. Holiday, I appreciate that too. But I think you may have said it earlier, and Polly Rich, she said, still considering the question, initially thinking we should honor him only by the words in his last letter.
Yeah.
That would make the most impact for Bermuda if we all do as he asked. You know what's so interesting about Sir John? Sir John was probably the most pro-Bermudian politician or leader of our lifetime. He was so pro-Bermudian that if you and I said some of the stuff he said publicly, we would be called xenophobic. He was pro-Bermudian like that. The day I see a leader as pro-Bermudian as Sir John, I will start to believe again. But until we get Bermudians who can be pro-Bermudian in the most loving way, he wasn't pro-Bermudian where he disrespected other groups. He was pro-Bermudian where everything he thought to do was, well, how Bermudians going to benefit from this first? And
he had the ability to, right?
Yeah.
Like, there's soft skills and hard skills. You can't rock up to the White House and negotiate a tax treaty on vibes or on, tax codes. That's a part of it, but that's a fraction of the job, right? Like, he had this essence that allowed him to maneuver these spaces and carry that pro-Bermudian mantra, but also combine it with policy and action. And incredibly rare, incredibly rare. Yeah,
indeed. Folks, we've got Dr. Ricky Brathwaite coming up after we take a break, but he's the CEO of the Bermuda Health Council, and you guys seem to have a lot of questions about healthcare in Bermuda, so we'll get to that But let's wrap it up real quickly. We've got to give some love to Titan Express and Secure. And then we've got Bermudian Icons, and it's only fitting that we have a true Bermudian icon this morning representing. So let's show some love to Titan Express and Secure.
The daily discussion is brought to you by Titan Express and Secure. Titan Express delivers safe, professional, and reliable transportation and tours across the island. From island tours to cultural experiences, they set the standard. And Secure is your go-to for property management, waste management, and residential and commercial services. Visit securebda.com. Professional, punctual, and reliable service is their commitment to you.
All right, let's go check out the Bermudian Icons, brought to you by ZipX.
Welcome to TDH's Bermudian Icon series, brought to you by the great folks at ZipX.
Sir John Swan was one of the most visible, cherished, and respected figures in modern Bermudian history. There are a few names that command universal respect that cuts across party, race, age, and class. And yet, Sir John Swan is easily and unambiguously one of them. He moved with a vibrant and charismatic love for Bermuda and her people and represented a distinctly high level of diplomacy and political behavior. In fact, it was Sir John Swan who ushered in a new level of political behavior for Bermuda. He was the longest-serving premier in Bermudian history, the first living national hero the island has ever recognized, and barring any changes to the committee rules, is the last person who ever will be. As an entrepreneur and a real estate mogul, he constructed homes and buildings that put ownership within the reach of ordinary Bermudians, many of whom were owning for the first time, which means that he didn't just talk about economic equality as a lowercase conservative, he built it, one house or building at a time. As premier and statesman, he transformed what Bermuda was into what we now enjoy it as. He sat in the White House with President Ronald Reagan and Colin Powell and conducted high-stakes diplomacy that put Bermuda, a 21-square-mile island, on the global map. His 1985 tax treaty with the United States ushered in a new era and cemented Bermuda's place as a world center for reinsurance and international finance. And he also began reshaping Hamilton itself, building higher, building smarter, and laying the foundations for a capital city that could live beyond its destination as a tourism item, business hours, and carry an influence well beyond its local shores. Sir John Swan was also one of the few former leaders who never stopped showing up even after they left office. He was remarkably visible to the public and spoke on a variety of issues, including the state of Bermuda, CARICOM, and most recently, personally motivated a wave of independent candidates in the 2025 election, which urged a disruption of the status quo that he believed no longer served his people. In a letter written to Bermuda, released after his passing, Sir John Swan urged Bermudians to take care of one another and the island that we share. That level of public engagement, the refusal to be silent while still active and even when the country needs a voice, is what separates statesmen like Sir John Swan from regular politicians. Sir John Swan did all of this as a proud Bermudian who believed in free markets and social responsibility. Sir John Swan is what a giant looked like, one of Bermuda's greatest icons and one of Bermuda's greatest.
And that's today's Bermudian Icon series, brought to you by the great folks at ZipX. Now back to the show.
Alrighty, only fitting that the recognized Bermudian icon this week was Sir John Swan. Thank you for that, Teray. Do you have any days of the year for us today?
I do. Today is National Best Friends Day. Best friends and friends generally are good for our health. I mean, we can ask Dr. Ricky Brathwaite what he thinks when he comes, but our relationships that we have with other people are health indicators. So I want to ask you, Jamal, when's the last time you called your best friend?
Week before.
Call him today. Call him today.
We speak. It's crazy because we probably chat like once a month and just check up because we're guys, you know.
Once a month?
Yeah.
I have to talk to my best friend every day. Are you kidding?
Yeah, we're different. Like, it's funny because I tell people, I'm like, me and my two closest friends, we speak literally probably once a month. And yeah, it's just, we're guys. We act like guys, but it's always check up, like, you know.
Okay, I'm curious about the audience and if like they're in my boat or in your boat, because if I don't talk to Asia on daily, whether that's a text, a voice message, or a quick phone call, I'm liable to go crazy. I just need to talk to her. That's my support system.
So basically, you want to, how often does everybody speak to their best friend?
Yeah.
I mean,
it should be every day.
No, so no, like my two best friends, like, so I define my friendships. I mean, I grew up with them like from ages of 3, 4. So like we went different ways, but we still like my best friends. If one of us need a kidney, we're doing it. But there are friends along the way where, as people I talk to every day who literally probably part of my life more, but I wouldn't say they're my best friends, but like we exchange, I'll call her name, like Sister Jamaica. Jamaica Smith, she lives out in the US, but Bermudian, and she's played an integral role in some things in Bermuda causes. And we chat every day, just shooting the breeze. It's a number of people I talk to every day, but I would say best friend, yeah, it's about once a month, yeah.
I wonder if that's an age thing. Like, like we're both kind of like just starting out. I'm still in school, so we have all this time to talk. But maybe once you get married and have kids, you don't have time to talk to your best friend. So maybe you're right, Jamal.
Life happens. Well, Charles says every day. My goodness, once a month sounds about right. Yeah, you're right, Charles. And I'm just like, honestly, phone call wise, it's probably like once a quarter, if that. Like to the point, if my boys called me multiple times a month, I'm gonna think something's wrong.
Really?
I'm like again, if we communicate, especially during football season, be like, oh, you saw that, whatever. But it's like every day.
I'm the opposite.
Age has an impact. So traveling Trotty, I'm not trying to say you're 70 or anything, but how often do you speak to your best friend? Because I was wondering if it was a gender thing as well.
Yeah, it might be, because if I don't hear from Asia for 2 weeks, I think something's wrong. If I don't hear from them, then I think something's wrong.
I didn't say that out loud. Paulie Rich says average about twice a month. Okay, twice a month. We've got Traveling Trotty said every 2 weeks, life be life, and okay. And we've got Suzanne Ingram says I don't chat to my best friend every day. Been like this since I started working in 1972. Me too, Jamal, every day. Yeah. So Ray, yeah, enjoy it while you can.
Okay, I guess I will. Maybe we're codependent. I don't know, but yeah, every day.
Yeah. All right, folks, let's take a quick break. Got a very important conversation coming up with the CEO of the Bermuda Health Council, Dr. Ricky Brathwaite. You don't want to miss this. Get your questions, comments ready. You all seem to have a lot of questions for him last week, and he wasn't even here yet. So let's get this conversation rolling in about 3 minutes, 37 seconds. In the meantime, if you are streaming with us on one of our social media platforms, Facebook, LinkedIn, YouTube, Twitter, X, or Instagram, make sure you give us a thumbs up, a love, a like. Make sure you share the conversation with your friends, your family, your colleagues, and we'll be back to continue this most important community conversation on Bermuda's Daily Talk Show, The Daily Hour. Stick with us.
Children love to play and have fun, and they love gifts even more, especially ones that they can enjoy and learn from. With Bermuda Trivia coloring books, kids can explore the island while they color, learn, and create. The perfect activity for fun and learning together. Available now.
Visit BermudaTrivia.com and follow Bermuda Trivia on your favorite social media platforms to learn more.
Hi there, welcome to Medical House. We're located at number 6 Bakery Lane. I can't wait to show you all of the great stuff that we carry. Come on inside, let's see. Long days, long shifts, you no longer have to endure comfortable underwear. Designed by nurses, we now offer premium undergarments by Swoop that are unique, fun, comfortable, and functional. The only underwear you'll ever want to wear. Who says high-quality functional products can't be stylish and comfortable at the same time?
See it all at our new expanded location on Bakery Lane.
Discover Drop It, your go-to grocery delivery. Browse and select from a wide range of groceries, from fresh produce to daily essentials. Our friendly drivers deliver fresh groceries to your door fast, saving you time and hassle. With Drop It, you get fresh groceries delivered fast, so you can focus on what really matters. Drop It, freshness at your doorstep, delivered to your door with Lindo's. Why go anyplace else?
What lasts isn't what you buy, but what it becomes. With the HSBC MasterCard credit card, every spend quietly adds to a story shaped by intention and offers what matters most. Support that meets you where you are. Protection that preserves what you choose. Confidence for the unexpected. Peace of mind wherever your story leads. Start your next chapter Use your card today. HSBC is licensed to conduct banking investment business by the Bermuda Monetary Authority.
Hey, you wanna come get some? Playing around, playing around. I got it, no doubt.
Ever taken medication and thought, why is this hitting me so hard? Or why isn't this doing anything at all? Here's something you may not know. Your body processes medication the same way it needs to process food, using enzymes. And these enzymes metabolize medication so it can be converted into its useful form or removed from your body. Pharmacogenetics looks at how your DNA influences the way your body metabolizes or breaks down medications. It helps explain why a drug that works well for one person causes side effects in another and barely works at all for someone else. That means the same pill at the same dose can feel very different from one person to the next. It's not about blame, it's not about doing something wrong, it's simply biology. And once you know what works best for you, medication decisions stop being guesswork and start becoming personalized.
Alrighty, welcome back to the big show. She is Toretto. I'm Jamel Hartman. This is the Daily Hour brought to you by the BAC Group of Companies, HSBC Bermuda, Medical House, Lindo's, People's Pharmacy, and big love to Hot 1075 for ensuring that we can pump through the radio airwaves with these most important community conversations. Audience, please do not forget to subscribe on our website and follow us on all of our social media channels to stay up to date with all that we have going on. Help us grow beyond the mic as we do our part to continue to improve our community. Folks, I just want to give a big announcement. So for the fourth year in a row, we're going to be producing and hosting Bermuda Cup Match Selection Night on July 25th this year. So you want to make sure you are engaging with us live. Some people like to choose to wear ugly colors during the summer months. Yep, red and blue does not go together during July. I'm sorry. But please, St. George's fans, make sure you tune in live on bcgtv.com and make sure you're a part of one of Bermuda's most special nights as we find out who makes the team. Hopefully, some of people don't show up to work that day and we can just have a full St. George's show. How about
That's
that?
how you want to win? That's how you want to win it?
Yeah.
See? Easy way out.
Yeah. If y'all didn't show up, we win, right? That's how it works, right?
I guess. Somerset fans wouldn't be okay with that type of win. We like to play and win on merit.
I got a question for you.
Okay.
Who you think Dr. Brathwaite supports in Continent?
Somerset.
You think so?
I mean,
He seems like a winner.
I feel like he does. I feel like I've seen him around the club or someone who looks like him.
I hope it's somebody look like he don't look like he want to wear this kind of color. Anyway, you know what, folks? Let's give a warm. I got the right music because I want to make sure. I want to make sure that we don't. Okay, yeah. Let's make sure. I don't want to have the booing crowd. That's for Somerset people. All right, let's give a warm TDH welcome to St. George's fan, CEO of the Bermuda Health Council, Dr.
You better clarify that immediately.
Good morning, sir. How are you?
Good morning. I actually do think red and blue look pretty good during the summer.
Yes.
Just letting you know. But we're all beautiful people. How about that?
This is not starting well.
It's starting perfect. It's starting perfect. You can stay a while, Dr. Ricky. Stay a while.
Well, you know what? We're happy to have you either way. But before we get into the meat of the conversation, the important stuff you came to discuss, Teray, at 19, 20 years old, that's how old she is, she talks to her best friend every day. Good doc. How often do you speak to your best friend?
So I spoke to my best friend yesterday, and I was listening to a conversation. I was thinking, as guys, we probably do need to check in with our best friends a little more often than once a month, because we probably need them a little more than we think we do. So I think we've been socialized to kind of put a little distance, and we're guys, but we probably need our best friends a little more than we think we do.
Listen to the doctor. Listen to the doctor, Jamal. If you don't want to hear it from me, take it from him.
Yep, he's like, from a health perspective, we need to check in. You know,
We need to check in.
I think Teray predicted that. But thank you so much for dropping by. It's been a while. It's been about 3-4 years since you've been on this show, I think. So I'm happy to have you back. And as we jump into the conversation, let's speak to the audience about, there are people who just read the Health Council in the newspaper, may see it on the news. They've heard of it, but may not fully understand its role. What exactly does the council do? And how does it support Bermuda's healthcare system?
Yeah, so I mean, you've been having a pretty wonderful conversation about kind of reflecting on this idea of taking care of each other, and Sir John Swan's his kind of legacy and his impact, and what the Health Council is trying to do, and it was set up to do, was to serve as kind of a balance for our healthcare system. How do we keep our health system in balance? How do we make sure that people have the right access, that the healthcare is affordable, and the system itself is sustainable? So the Health Council, I was actually at my best friend's wedding the other day, and there was a moment where we were all on a boat, and the captain comes on the boat and says everyone has to move to the left side of the boat because the boat has become imbalanced, and we all need to make an action to kind of balance everything out. So the Health Council serves in some ways as the support captain for the system, saying that doesn't look right. Everyone needs to reallocate resources to the left, so we balance out our system so patients at the end of the day can have the best care possible. So that's where we are with the Health Council. We do it through regulation, which is getting people registered within the system, knowing what's there, ensuring they're compliant with the law. We do it through enhancing the system, through developing programs. And we do it just through listening and finding out what people need and trying to coordinate the system in a way that makes sense. And we can only do it based on what's in the law. And so that's also our limiting factor. So a lot of times people say, why aren't you doing certain things? Well, the reality is that the law sometimes doesn't allow us to, but we do provide recommendations and suggestions as to what to do next in terms of changing the law or ways that we can get around it so that people can be protected and helped out.
Indeed.
Yeah, and the Health Council just launched the Helping Hub. What is the Helping Hub? How does it help improve access or improve balance, access to health and social support services, and who can benefit from using it?
Yeah, everyone can benefit. So Helping Hub is a platform. It's an online directory. It's empowered with AI. And one of the things that we often see, and I think everyone sees it online, on Madge's list, where can I find this doctor? Who can I contact? Do we know anybody, any specialists in this area? And what we haven't had so far is this centralized place where everyone can go to and find out what's in the system. Because we often see once someone gets diagnosed with a condition, chaos ensues because they don't know what to do next. They don't know who to call. They don't know what resources are available. So we want to try to make life a little bit easier for our community to be able to find all information in one place. So helpinghub.bm is where we've kind of created this platform for doing exactly that. Because, we can talk about hospitals and we talk about doctors and nurses, but we really want to be people-centric. And one of the things that people often say is, I don't know how to find X, Y, and Z. And so we're trying to help that out specifically by creating this platform.
Indeed.
Yeah. Healthcare services and systems across the world, whether that's a good system like Canada or not so good system like the US, are facing challenges related to cost and access. What are the biggest challenges and pressures facing Bermuda's healthcare today?
Well, I think everyone is very clear that it's expensive. And I know milk and eggs and everything's expensive, but when you're trying to just be healthy, when you're trying to go to a doctor and follow directions and you have to be referred to a specialist and it's $400 out of pocket, you probably some people just don't go. And so affordability is probably the main thing. And what we're trying to do through universal health coverage, and I'm very excited about the progress that we're making. I know it's been a long time coming in terms of changes within the system, but I'm just excited about this roadmap that's being developed around universal health coverage that really looks at dealing with the issue of copays or balance billing. You go to a provider, you're charged a certain amount, your insurance pays a certain amount, and then you're still left with this big bill. And especially for essential services, whether they be about prevention or an emergency service that you need, you shouldn't have to go through this challenge of deciding, should I go because I don't know if I can afford it? And so universal health coverage is really geared up right now to be able to deal with this copay issue. And so we're really proud about that rollout. Hopefully there aren't a lot of barriers along the way, but we're really looking to ease the burden for the public. And one of the things the Health Council does is advise on things like that.
Yeah, that's a nice dovetail, because I wanted to talk about universal health coverage. There was a period where there was a lot of discussion about it, and in my view, it kind of vanished from the public discourse. So can you talk to us about what progress has been made and how the Health Council is supporting or coordinating these efforts? But also, I want to pick up on something that you just mentioned about hopefully there's no barriers. What barriers do you mean? What barriers are you anticipating? Talk to us about that if you can.
Yeah, change management is tough, right? So you can have the best intentions, you can have the best plans, but what has happened over time is that there's been a lot of pushback into change in general. And what's been a little frustrating about some of that is when we haven't made changes. You know, there's been a plan made in 2012, a plan made in 2018, a plan made in 2024. When we don't make these changes and something bad happens, or when we have these stories about the hospital being overcrowded, you start to say, well, I wish we could have fixed this in 2012 when we had a plan that could affect these things. And what happens often is people push back and say, no, the system's just fine. Don't change anything. And we realize years later, no, the system was never fine. You know, it works for some people, but it doesn't work for all. And when it doesn't work for all, we get this congestion of those who are disadvantaged, leading to impact on everyone. So what we've been doing with universal health coverage is coming up with the plans. We've been working on integrated care pathways, which means, for example, what do you do when you're diagnosed with diabetes, or what do you do when you're diagnosed with cancer, and what is the pathway, the ideal pathway that a person should go through, and are we ensuring that we have the right people and infrastructure in place? So those are plans being put in place. We're looking at workforce. If you think about workforce around the world, we often think about nursing. We're having a shortage of nurses. That's not the only profession that we have in healthcare that has a shortage. So we're working on things like workforce planning. So we've recently developed a workforce strategy that will allow us to proactively think about how do we recruit, retain, incentivize workforce here in healthcare. And so those are the kind of things that we're doing. A lot of it hasn't been publicized yet. And I know part of that is there's always a fire that needs to be put out. And so from a marketing or a publication standpoint, there's always something else that's coming up, whether it's been a hospital recently. So that takes away the ability to really push forward some of the agenda around universal health coverage. So we have to get to a point where we're not always putting out fires, because that does make people feel like we're not being transparent about the process. But what it is just the priorities change on a rapid basis. And so the public's not getting to hear some of the really good work that's taking place because they're hearing about the headlines. And so we need to change our way of kind of dealing with crisis, because it always seems like we're in a crisis.
Yeah. And I mean, the public, they're reading the headlines, but they're also experiencing the healthcare system firsthand, right? Like they're going into the hospital, they're experiencing urgent care. So what would you say to the people who are like, oh, actually, universal health coverage sounds good, but I can't see a doctor for 5 hours? Like, what about those concerns?
Yeah, no, those are real concerns, whether it's the types of stories that we hear, not just stories. These are conversations that we're having, where someone has an accident and they weren't insured and they have no ability to go overseas because LCCA is out of money, or the baby in the newspaper who needs a surgery and the funding's not available. These are real issues, and the Health Council and whether it's myself getting on the phone, we're always talking to people, and we realize that, again, when people say the system is fine, you can't go to some of these individuals and say the system is fine when they're dealing with these kinds of barriers to the simple things that we should be affording or taking care of each other, right? We should be taking and looking after each other. And the reality is that some people are falling through the cracks, not getting the care that they need, and dying unnecessarily. And that's real. And so we have to really step up our game, because our legacy, our community, our generation, our next generation really depends on it. And it's so sad when we're trying to deal with people who can't get care, while we're also dealing with the violence. We're also dealing with the accidents on the mopeds and the deaths. I mean, it is a lot going on at the same time. So, the voice, again, how do we take care of each other, really needs to be ingrained in our everyday thoughts and our everyday actions.
Indeed, Dr. Brathwaite. Just bring Teray back in. Indeed. We'll go to the audience in a second. And audience, if you have any questions or comments, you can continue to send them through. We'll get through as many as possible. Teray, you had another question?
Yeah, one more, because I know, Dr. Ricky, you're really passionate about healthcare. I remember you during the pandemic, you were kind of like first responder, like you were just very visible. So I want to talk to you about reform. The Health Council plays an important role in healthcare reform. How would you and how do you balance affordability, access, and long-term sustainability while evaluating these challenges of these fires, as you say?
Yeah, I mean, the truth is, and I was just actually talking to a friend the other day, and he said, "Oh, you can just fix healthcare by paying the doctors more." And he's a physician, and my brother's a physician, and often the conversation tends to be in healthcare about money and who gets paid. And the reality is that if someone gets paid more, someone has to pay more, right? So the reality is that everyone has to give a little. And we ask a lot of our providers, or we ask a lot of our nurses, we ask a lot of our podiatrists and so forth. We can't keep elevating the cost of healthcare while expecting it to stay affordable. We can't keep charging high premiums by our insurance companies and at the same time talking about record profits and expecting the consumers to pay for it. Like, that balance doesn't make practical sense. We don't have money trees growing in our parks, like we don't. So we exist within a box, and from a health economic standpoint, you have these constraints. You say, if you give someone money, you're actually trading off something else. If you give someone more money, reality is that you give someone more money in the system, you are taking away benefits from someone else. So we have to create balance where everyone's not looking out for themselves, because what we're doing right now is everyone's pulling on, this is my rope. And as long as my rope allows me to get to where I need to, I don't really care about anyone else. And that's where the Health Council has to play a bigger role in facilitating larger conversations amongst the various stakeholders.
Yeah.
What we got in the audience, Teray?
We got a couple of questions, and I think you may have just given us an uncomfortable truth, but Traveling Trotty says, if you had to tell the public one uncomfortable truth about Bermuda's healthcare system, what would it be?
Healthcare has become big business. It's uncomfortable that it's not about just care anymore. The amount of calls that I receive, how can I make sure that I can get reimbursed by insurance, outweighs the amount of calls of how can I make sure my community members have access to the right foods, the right exercise. So the business of healthcare, I think that the tilting is over tilted to this business versus kind of a community good or a public good. So that's an uncomfortable truth, that we have made healthcare a business just like finance or retail. And we have to question whether that's the right direction we want to go down.
Yeah. And speaking of questioning the direction that we're going down, Charles H. Jeffers II says, we've heard of issues surrounding the BFNM and Argus merger, now known as All Shores. Many saw this coming when it was announced. Is the Health Council in support of anti-monopoly laws related to healthcare? How do we protect consumers?
Yeah, I think we're and I'm not going to nuance this. I'm going to say anything that negatively influences the ability of a consumer or a patient to get the care that they need is a problem. So if you have these big businesses that are looking to cut costs, which means there often leads to things like denial of benefits or reducing benefits. So we've seen this coming. The reality is that from a legal standpoint, there is nothing from a legal standpoint that can stop it from happening. But we have to figure out, how do we strategize to ensure that businesses are responsible, that patients get the care that they need. You know, BF&M and Argus, the merger, started out with the purchasing of medical practices, but no one says the question of, well, who sold the medical practices to the insurance company? It's always it's an interesting conversation, but there's so many different angles to it. And I think over time we realize, and history will say, based on other markets, that such mergers lead to more control by those who are owning these businesses, and therefore ultimately they're going to look out for their best interest, which may not always align with the best interests of the public. And so the same thing with the issue with the merger leading to the pharmacy issue. Again, from a legal standpoint, there is nothing in the law that says we can determine what the operations of a business can be in terms of how they process their operations. But it's also frustrating when, again, there was a precedent for this happening in another insurance company, and then there's an outcry for this when a different insurance company. And we have to be fair across the board and say, do we as a society want the same thing for everyone, or are we going to pick and choose our battles and say we prefer one company can do it, but one company can't? And so it's an uncomfortable truth, but we have to change the laws. We have to update the laws in general to be more proactive in ensuring that we're not going down bad paths around this.
Yeah, absolutely. Michael Daniel says, is there any value in considering something like a rehab center to supplement King Edward Memorial Hospital?
There actually is. Turning Point is part of, well, if you're talking about addictions, but if you're talking about rehab in terms of inpatient rehab, physical therapy, and so forth, both of those are available as part of Bermuda Hospital's board. Whether they are meeting the demand out there, that's a different question, which is part of this inventory of Helping Hub and gathering data. What do we really need from a public standpoint? And do we have the resources, whether it be through KEMH or in the private sector, to meet them? But that's one of the things, yes, there are also questions as to what we do have. And that's one of the things that Helping Hub is set to help with.
Yeah. I was going to say, it sounds like just good information to know, because I think part of the challenge is people just don't really know what's going on. Like, I didn't know that the merger of BF&M and Argus started with the sale of a medical practice. So it really is just the more you know. But we have another question from Travelin Trotty. She says, Bermuda spends heavily on healthcare, yet chronic diseases like diabetes and hypertension remain major concerns. Why haven't we shifted more toward prevention, and who is responsible for driving that change?
Yeah, that's exactly. So phase one of the universal health coverage kind of roadmap is really focusing on prevention. You would have seen some of the changes kind of dripping in with things like annual physicals, being able to get those without having a copay. But you're right. We spend so much money on acute care once the problem has gotten so far down the line where we have so many complications. We spend so much money at the expense of doing things like investing in our own health, investing in prevention. I was just at Cooper's Island yesterday, and just the idea of getting out there and breathing fresh air, taking the time, things like that are free ways to de-stress. So there are some responsibilities that we can have in terms of kind of aligning our lives to wellness. But in terms of a structured system, yes, universal health coverage and the plan that has been put forward is really focused on turning the knob backwards from acute care kind of centric to prevention. And we're really happy about that kind of change. And hopefully for the years looking forward, we'll have healthier population as a result.
Indeed. Just want to go back to the audience real quickly, because I think people are stuck on the fact you said there's no laws. And I think what's really annoyed Bermudians across the board over the last probably decade or so is that we seem to be a very reactive group when it comes to not just politics, legislation, policies, but just in general. Charles H. Jeffers II saying, there are no laws currently. Should there be? Has the Health Council made any recommendations for changes in law? What if All Shores and CG announced the mergers today? And I think I'll just what Dr. Anthony Richardson said. Are you dealing with insurance monopolies? Is there going to be changes to the core and associated regulatory regime?
Yeah, so both of those questions, what if one of these changes were to be announced today? The reality is that CG and All Shores wouldn't have to tell us in advance that they're going to merge. They would typically do this is a heads up just to let you know that we are merging. From a legislative standpoint, we have put forward kind of recommendations that any major changes within the system should go through an approval process. That would be a change. So yes, we have put forward not just suggestions, because we're not just saying, hey, we suggest. We are put forward structured proposals as to how to deal with these things. Again, ultimately, it is up to cabinet to ultimately take on these proposals, and not just take on these proposals, but then there's this legislative process which isn't always quick, because healthcare is not the only piece of legislation that needs to be passed. There's housing, there's transportation, like there's so many other, education, all these things are needing to be passed and talked about. So often, even if we put something forward today that's the best bill in the world, that doesn't mean it will get passed for 18 months. And that's what happens in the meantime. The changes happen, then you're like, oh, I wish we would have passed this earlier. But that's just part of the process, unfortunately.
I just want to go back to reform real quickly. I guess, you guys are data-driven.
Right.
Is there anything that your data has told you isn't working for Bermudians? And if so, how has the Bermuda Health Council used that data and information to help drive policy or legislative change?
Yeah, so things like we're paying too much for drugs as a market. We are paying premium prices on top of premium prices for drugs. And so one of the things that we put in place was a drug formulary to start looking at procurement to regulate the cost of certain drugs. So that's one of the things. And I think one of the things that always sticks with me, one of the vendors in another country said, oh, you guys don't negotiate on prices for drugs because you typically only have one vendor bringing in kind of supply. And that's why companies laugh at you, because there's no competition around these things. So they get over on us as a country because we don't have the infrastructure in place to really put out RFPs or to bid for these things. So drugs is one area that we've looked at. The data says also that we are having some issues around cancer care and continuity of cancer care. We're sending too many people overseas based on limitations in our workforce here. So we're looking at ways. We actually did a feasibility study around what the status of cancer care is looking like these days. We know from a fact that we have too much chronic disease, which was mentioned. We have too many accidents. We don't have the workforce in place, which means that we're sending too many people overseas. And again, as a business, think about businesses who are getting higher percentages from Bermudian patients when they come overseas than they would get from their U.S. insured. So they're doing a bit of this, right? And since we haven't repatriated some of our services or brought some of our services back home and being able to do them here, we are spending a premium in overseas care, which is why you often see a lot of hospitals coming here to represent themselves. But those are some of the things that the data tells us. And we have a lot of data, but we also need to do a lot more in terms of analytics and doing more predictive analytics as to what the data tells us the future will look like.
I think it's a scary situation with the healthcare system in Bermuda. I said on this show recently that one of Bermuda's greatest mistakes was trying to follow the U.S. academically, right? And it seems like this situation with the merger of those two insurance companies seems to be heading the same way of U.S. healthcare system, which is dangerous for Bermudians, because the healthcare system in the United States is like the prison system in the United States. It's all about generating as much revenue as possible. It's not about health care, like the key word care. And with people listening today or tuned in, they're probably like, wow, so there's nothing stopping tomorrow if another merger were to take place. I mean, you see the comments. Bermudians are literally afraid right now of being told they can get their, and I use the Uber example. It starts when Uber first came on the market. It wasn't just convenient, it was cheap, right? And it always starts like that. And then over time, it becomes the in thing, and prices now get to where the cabs were. And so I think, while being told that, it's going to be cheaper drugs and so on, by taking choice away, which is in a free market, it's just interesting. That would be something. What's also scary is who's to say these insurance companies can't be like the other insurance company and just go open their own pharmacies when they're done with the Phoenix stores, right? So it's fascinating. And I appreciate that you've engaged us directly this morning, but I really hope that there's, like you said, the government has housing, they have education, crime, so many other things to do. I'm going to answer like Teray would. I don't think one's more important than the other. I can't, because just because something may be more important to me doesn't mean that Teray is going to find it just as important. They need to find a way to make this a priority to help Bermudians to push this stuff through cabinet. This is a bad situation, and I really hope that something can be done. I want to shift gears real quickly, though, because Bermuda is hosting the 17th Caribbean Conference on National Health Financing Initiatives. What is the significance for Bermuda? Why is it significant for Bermuda, and what opportunities does it create for collaboration, innovation, and the future of healthcare in the region?
Yeah, and that's exactly right. We're hosting a conference. It's the 17th year, so it's not the first time the conference is taking place. So we're hosting a conference not just to showcase Bermuda. We're actually using it as a strategic opportunity to look at ways that we can collaborate or learn lessons from some of the other countries. For example, the Eastern Caribbean states, they have a procurement process which they collaborate to buy drugs, and they get drugs a lot cheaper than we do, right? Jamaica has the National Health Fund, where they get drugs a lot cheaper than we do. So some of these are strategic ways to strengthen relationships or strengthen partnerships, or just to learn what people are doing about, for example, long-term care in Turks and Caicos, or Cayman Islands, where, when I visited Cayman Islands and visited the hospital, one of the things I asked them was, what are you doing about boarding in the hospital? And they said whenever they get 3 or 4 people in the hospital, it becomes a mass kind of exercise where everyone contributes to making sure that person finds a place outside the hospital. And we're talking in our hospital, we're talking about 120, 160 people that are in essence boarded in our hospital. And in a country like Cayman, who has similar population, to have 3 or 4 people means that they're doing something different. Doesn't mean that they have the perfect solution, but we can learn from some of the systems that are similar in size, similar in culture, similar in characteristics. So we're really taking the opportunity to bring some of the major decision makers within the region into Bermuda to talk about, issues that are important to all of us. Because the investment in holding a conference really is about what we can get on the output of it. And I think it's worth it to us to be able to bring all these players into a system like ours and be able to see what we're doing and have them provide insights into ways that they see that we can possibly do things differently. And going back slightly to the question about the United States, we see what the United States has done. We see that there's a CVS on every corner, that the small pharmacies, the small medical practices have in essence gone out of business based on, corporates taking over. So we see the direction that we're going. The question then becomes, ultimately, is that the direction that we are going to be happy with, or do we want to preserve some of the legacy, the small businesses, the mom and pop kind of businesses? Do we want to preserve that, or are we looking to become a corporate kind of jurisdiction where it's really about the dollars and cents, and it's really about the branding on a building? Are we trying to preserve the legacy that families have built? And that's a real question that we're going to have to answer, because if we do nothing, we're going to go in the same direction, and we know where that leads.
Yeah, indeed. We've got Charles H. Shuffs II says, with data being so vital in predicting future needs, how important is Dr. Weldon's work with Carry Genetics for the Health Council to be more proactive?
Yeah. Yeah. So, and I'm not a geneticist, but I did do, in the sciences. So, and we have had conversations with Dr. Weldon. We are all for the innovation that she's looking to bring to the table. We're interested in the work. She's looking for further investment in general in the work that she's doing. So we are supportive of innovation. We just have to be, as a health council, we have to be careful about how we interact with various initiatives so that we're not seen as being biased or conflict of interest or preferential to specific businesses. But in general, genomics should play and will play a huge role when it comes to precision medicine, understanding what a population is predisposed to and understanding the risk, understanding how medications work on certain persons. So all that information is going to be extremely important in the future of our healthcare system. We have to be more surgical, but we also have to be more surgical, understand that if we're going to be more surgical, we also have to manage our costs, right? So a lot of these innovations end up being extremely expensive. You can get these precision medications, these precision drugs that you can cure something, for example, but it may cost $300,000 a year per patient to do that. And again, if you're going to spend that money on that one person, you are in essence taking the ability to spend money on someone else. And so there has to be a balance. How are we going to go about doing this? And if we're going to go down that path, how are we going to ensure that we're getting the best price? And that's where, again, the conversation with other countries come into play.
Indeed. So, Ray, do you have any final something? Because I know, Dr. Brathwaite, you have to run, but you got one more from?
Yeah, okay. Can you indulge me? There's two more. So Mark Arthur C. Phillips says, "Good morning, Dr. Ricky. Thank you for being honest. You were right. There's a lot going on in our society, but we as a society voted for MPs to do the job. And then Charles A. Sheffers II says, "Many of our seniors are leaving Bermuda and moving to other jurisdictions because of cost of living. With healthcare being that part of cost of living, is there a plan to provide seniors with relief?"
Yeah. So So I'm going to answer this. Seniors are a huge part of kind of the plan of how do we reduce costs, because we know that they've put in to a society for years and years and years, and often they've gotten little out of it from a structure standpoint as a return. So things like reducing the cost of premiums, Future Care is a good plan, which was set up for seniors. What we need to do is continue to enhance that plan so that for the value that they're getting it for a good cost, and they're not feeling as though they're underinsured by getting a plan like that. So continuing to do that. A big cost center for seniors is going to continue to be long-term care, and it is related to healthcare. Long-term care, we have to put more investment into number of beds in the community. We know that we're going to have a shortage of beds. We know that if we have a shortage of beds in the future, more people are going to have to be taken care at home, which means that more people are being taken out of the workforce, which means less people are contributing. So all these things. So yes, seniors are extremely important part, but we also have to look at the generations that are coming after our current seniors to ensure that they're not making some of the same, and I know this may sound a little offensive, that our younger generations aren't making some of the same decisions and following the same behaviors that have potentially put some of our seniors in the situation where there's so much chronic disease, so much morbidity. So we have to do better. As our parents would say, I put you here and I expect you to do better than we have. So we have to do a little better so that when we become seniors, we don't put such a much burden on those who are coming behind us.
I promise you. Final question from the audience. Traveling Trotty's asking, the sugar tax was intended to support healthier choices. Has the Bermuda Health Council measured whether it has actually improved health outcomes, or has it mainly increased costs for consumers?
Yeah. So, I mean, I know personally, I buy less candy because it's expensive. Right. But that's just a personal thing. From a system standpoint, the Health Council doesn't have explicit data on the retail purchases at the supermarkets or the stores. We do have an idea, or based on kind of public reporting, how much money is being collected. But the intent, okay, so our recommendation, I guess from the beginning was always, and I think the intent was, money raised through the sugar tax would be invested in specifically in healthcare things that would help to also mitigate the risk of those who have either eaten different foods or wrong foods over time, and kind of help to promote healthier lifestyles. And so we're not exactly sure how effective the money being reinvested in the system has been. And so, yes, we don't have specific data on that. So that is an area of limitation that we do not have information at this point in time to be able to report back. So that's on us, right? Not being able to give you a good answer to that question.
No worries. How can people get in touch with the Bermuda Health Council if they had more questions or wanted to engage?
Yeah, you can always call me. And I say that because I think part of my job is to be available no matter what, right? So regardless of my title, part of my job and part of my passion is to kind of be able to talk to people. And it also helps me to do my job by hearing what people have to say. But you can call us at 292-6420, or that's 292-6420, which is our main line, and ask for Ricky. Ricky is fine. And I'll put you in touch with other members of the team if that's applicable. Or you can reach us at contact us at healthcouncil.bm. And if you were just searching the web, go to healthcouncil.bm, and you can find some things. And hopefully on that page, you can find our contact information and reach out if you have questions.
Alrighty, Dr. Brathwaite, thank you so much for stopping by this morning. We'll definitely be in touch. Have a wonderful day.
You too. And thanks again for the conversation.
Thank you.
Ricky Brathwaite, CEO of the Bermuda Health Council. Audience, don't go anywhere. We're going to take our final break. And after this break, we'll be back to give our final thoughts and wrap it up. Stick with us.
Yeah, I don't got this. I'm gonna be fast at delivery on.
Oh, really? Don't pay me enough for that,
Oh, no, sugar! Okay, who's the faster? Who's the faster than me? Talk to me. No more stress, just sit back.
For over 70 years, Bermuda Pest Control has been protecting homes and businesses island-wide. We offer a full suite of services, including rodent control, termite fumigation, and general insect control and maintenance. Our team of experts will quickly and efficiently eliminate any pest problem you may have. With Bermuda Pest Control, you can enjoy a pest-free home in no time. We're committed to providing fast, reliable, and solution-driven services for our customers. It's what we've been doing since 1952. Call Bermuda Pest Control today and say goodbye to pests for good.
Dreaming of expanding your business? With BDC's Loan Guarantee Program, we support your ambitions. Get up to 75% guarantee on bank or credit union loans up to $300,000. Just your vision and our support. Apply today and unlock new business opportunities. BDC, Bermuda Business starts here.
Bermuda, there's nothing like a home-cooked meal, especially when you can feed the whole family without stretching your wallet. With the affordable Bermuda basket, you'll find savings on everyday staples like rice, chicken, corn, and more. Everything you need to make a good meal for less. Shop the Bermuda basket at Lindo's, Marketplace, the Garden Market, and the English Market. Visit costofliving.gov.bm to see the full list of goods and start planning your meals. This is a message from the Ministry of Home Affairs.
Life moves fast, and so can the unexpected. When you insure your home, you need to know that your insurance company has your back. At Friesenbrook, let one of our friendly and professional agents give you that peace of mind. Because when you are covered, you are confident. Call us at 296-3600 or visit friesenbrook.bm to learn more.
Alrighty, welcome back to the big show. Thanks again to Dr. Ricky Brathwaite and everyone at the Bermuda Health Council for stopping by today. Folks, I'm sorry, these are very engaging conversations. And at times, as you know, we do not get to every comment and question. We just don't have the time. But you can also reach out and you can comment in the, comment section, and hopefully someone from the Bermuda Health Council will engage you. But thank you for rocking with us. I want to give a big shout out and send gratitude to the BAC group of companies, HSBC, Bermuda Medical House, Lindo's, People's Pharmacy, and big love to Hot 1075 for ensuring we can do this for you. It is time for the Daily Play, brought to you by Bermuda Trivia, Novel, but stores throughout Bermuda. Shoe buy should be on shelves very soon. All right.
Hey.
Summer edition coming out. Follow Bermuda Trivia on Facebook, Instagram, Twitter, X, and TikTok to find out why it's Bermuda's favorite trivia game. All right, it's keys to the past today. So you can't say the answer, folks. Someone has to go and find the key. All right. Here is this week's clue. Keys to the past in partnership with Curb. He crossed the sea to find his stage and challenge norms of race and age. From war to art, his path was bold, a story of courage still retold. Find where stories come alive and where his legacy still thrives. That is your clue today.
That was nice. That was nice, Jamal. You had a little voice. You had a little voice going on, a little vocal action.
What's that guy named? James Earl Jones. I tried James Earl Jones just now.
That was nice. You did good.
So let's see if you all get that clue. Do not say the answer in the audience. Do not say the answer, but that's
so there's no quiz for us today. I kind of miss it.
You know the answer?
No quiz. No, I don't know the answer. I mean, when you said we don't have to give the answer, I wasn't thinking about an answer. Yeah, I turned off.
Okay, I'll tell you the answer once the show is over.
All right.
But you can't tell someone who's watching the show.
I can't tell someone who's watching the show?
Because then that's cheating.
Okay. Well, I can. Okay. Well, yeah, I can do that. I can keep my mouth closed.
Can you hold your mouth?
I can keep a secret.
Okay. All right. I'm going to tell a secret, audience, after the show. Renee Sherlin said it was a long clue. It was the same length, if not shorter than the others. Teray, real quickly, before we, well, actually, no. Let's give our final thoughts, then I'll ask you. So, final thoughts. I'm not asking about the World Cup, but final thoughts on this morning's discussion, Sir John, and then the conversation with Dr. Brathwaite.
Yeah, with Sir John Swan, I mean, what a loss for Bermuda, but what a giant and beautiful and wonderful life that Sir John Swan lived. I mean, really, like, what a Bermudian giant. So although it is a sad time and we're mourning the loss of a great statesman, I think we can also look to his life, look to his word, and find inspiration and hope. I really like that in his letter that he released, he had a directive for young people. And that showed me that he really is thinking about where we go long term. So I really appreciated just him as a statesman to look up to, because I think leaders that inspire and are charismatic and competent as one in one package are increasingly rare, and I think are only just going to become rarer as time goes. So I just have so much respect and admiration for Sir John Swan's life. And in terms of honoring him, I know the conversation will continue to evolve. The audience had a lot of wonderful suggestions, like statues, curriculums, just cementing his place further in Bermudian history. And I'm looking forward to that. But mostly I'm just reflecting on what we can do now in terms of political behavior to rise up to that standard of diplomacy that existed when he was premier. So yeah, just a lot of gratitude. And then onto the conversation with Dr. Ricky Brathwaite. I have mixed emotions. I feel like Dr. Ricky Brathwaite is really, really passionate about what he does. Like, that comes across very clear. But the state of Bermuda's healthcare system it's worrying. I mean, he was very frank and open, and there's a lot of exciting things coming down in the pipeline with the healthcare hub. But just from the audience, like taking the temperature with them, it's clear that there are a lot of negative experiences with the healthcare system, and worries that are only increasing through things like mergers and monopolies and antiquated laws. So that's not good for me to hear as somebody who's considering whether or not I should go back to Bermuda, because healthcare is important. It's a standard of life, long-term and short-term. So I feel grateful that there's someone and people at the Bermuda Health Council, at the hospital, wherever, who genuinely do care. But there are a lot of problems, and that came out quite clearly from the audience. And although I think they got good responses from Dr. Ricky Brathwaite, I think I'm looking forward to updates on like universal health coverage, how the healthcare hub actually does benefit and provide services for people. So yeah, good conversation, but it's hard to feel good about the state of affairs in Bermuda. So that's why I said I have mixed emotions.
Yeah, I'll say this as it relates to Sir John Swan. He was him. He was who many who've come since aspire to be, but don't come close. He was organic. He was himself. He was real. He loved Bermuda and wanted what was best for Bermudians. He said what was on his mind, and as he even got older, he used language that was even more direct.
Yeah, he did.
It was appreciated. And it's easy for people to speak about what he could have done differently. But even the least favorite Sir John fan will admit that they are able to live the life they live because of what he done throughout his premiership. A perfect man he was not, but the right man at the right time, not just during his premiership, but even after, as you mentioned, he was for Bermuda. And I hope that people take heed from his letter that he left and the many words he shared throughout over the last few years. The way he inspired a generation with a record number of independent candidates and made people believe that the options that we're given are not the only ones that we have. I think that leadership has changed. It's become so flashy. It's become loud. It's become about what's trendy.
And followings.
Absolutely. But I'm here to tell you, the reason that our most revered leader has transcended generations is because he was authentic. It's because he was a loving person. If for nothing else, for the Bermudian people. So I hope that the new generation can carry the torch that has been passed to them with love, with honor, and with hope that delivers the results that they'd like to see, not just for themselves, but for generations coming after them. Sir John told us when he ran, I'm not doing this for me. I'm not going to be here. I'm doing this for you. And that's how we have to get back to living. We have to stop being selfish and living for now and think about what those who came before us did. They didn't get to enjoy the fruits of their labor. We've done that. Now we have work to do to ensure that those who come behind us keep building, keep growing, and keep focusing on doing the work to ensure that a better Bermuda lies ahead for the community, family, and friends they love. As far as the conversation with Dr. Brathwaite, he was very direct. He was very honest. And he said a lot of things that will not make us happy. But the truth sometimes does that. I am scared for Bermuda's future from a healthcare perspective, but it's reflective of the state of Bermuda in itself. I'm going to just echo Charles H. Jeffers II here. He says, that was a good conversation, but I can't say I feel better about where things are headed as it relates to healthcare in Bermuda. Add this to the list of many things destroying the middle class in Bermuda. It's a tough reality.
It
right?
is.
Do you have any daily inspiration for us before we head out?
I do, but before we do, I want to kind of pick up a thread that you talked about with Sir John Swan when you talked about how he ran in the election and didn't do it for us, but did it for him, and we believed him. I laughed because I was having this internal juxtaposition between someone like Sophia Cannonier, who said, "Oh, I did this for you, like I did what I did for Bermuda," versus Sir John Swan, who said, "You know, I did this for you." Like the difference between how we, one, receive that, but also believe it, it's stark. Because it's true. Like Sir John Swan lived a life of objective success and still, like at 89, 88, ran in an election. And that is, that is true leadership. And I just had this contrast in my head about Sir John Swan versus Sophia Cannonier as you were going through that.
Indeed.
Right?
And I appreciate Sophia Cannonier, by the way. But yeah, that's a whole different topic. I'll get on.
Yeah, we can appreciate it for sure. Okay, but our quote for today is: "The key to successful leadership is influence, not authority." And that's from Kenneth H. Blancard.
Oh, I think we should share that with some folks. Appreciate it very much. All right, Teray. Well, audience, don't forget to subscribe to my website. Follow us on all of our social media channels to stay up to date with all that we have going on. Help us grow beyond the mic as we do our part to continue to improve our community. Thanks again to our partners, the BAC Group of Companies, HSBC Bermuda, Medical House Windows, People's Pharmacy, and Big Love to Hot 107.5 for ensuring that we can pump through the radio airwaves with these most important community conversations. As always, we appreciate you, we love you, and we thank you for making us part of your daily routine. If all goes well, we'll be back to do this again with you tomorrow. She's Teray Tall. I'm Jamel Hartman. Please do make it a safe and a great day. We are out. Peace.